Hey guys, today we're going to learn about the ophthalmic instruments, and in this category we will categorize the different instruments in the following different groups. The first one is lid speculums, forceps, hooks and retractors, needle holders, knives, scissor, and then we'll talk about the clamps, caliper, instrument for cataract surgery and intraocular lens implantation, instrument for lid surgery, instrument for lacrimal sac surgery, and instrument for enucleation and evisceration. Right? So if you know the instrument, name it before I explain it, right? And if you don't, here it is for you to learn. So let's begin with the first one that include lid speculum. So the lid speculum include, okay, so what is this? Do you know it? It is eye speculum with screw. It has two limbs with a screw to adjust the limb. So it has two limbs with a screw to adjust the limb. And it is used to keep the lid apart during surgical procedures such as cataract, glaucoma, squint, pterygium, and removal of foreign body from conjunctiva in cornea. So moving toward the next one. Do you know this one? It is basically a wire speculum, right? So we do have two types in the group that is called lid speculum. So the one is eye speculum with screw and the other one is wire speculum. Now we will move toward the forceps, the different type of forceps. The first one is, do you know this one? It is simple forceps known as plain forceps, and it don't have any teeth, right? You can see the magnifying image, it don't have teeth. When you see the forceps with teeth, then you will differentiate them. And the purpose of this is to hold the tissue during operations such as conjunctiva, scleral flap in trabeculectomy, skin during eyelid surgery, and nasal mucosal flaps, and lacrimal sac flaps in DCR operation, right? So this is plain forceps. The second forceps is fixation forceps. It has a narrow or wide jaw. It has teeth also. You can see in the magnified image. And what are the uses? It is used to fix the eyeball during the operation on the eyeball and to hold the eyeball during force duction test, right? The third one is superior rectus holding forceps. It is also tooth forceps, right? You can see here. And it is used to hold the superior rectus muscle while passing a bridle suture under the superior rectus muscle. So just know the name, corneal forceps. The forceps has very fine teeth at the tip. You can see a bit here. It is having teeth, but very fine, not that much prominent. Or you can point it. You can see here. It is used to hold the cornea or scleral edge, okay, after incision. For suturing during cataract, glaucoma, repair of corneal or scleral tears, and keratoplasty operation. So it has these uses. So the next one is suture tying forceps. The forceps has very fine plain tips, and it is used to hold the suture during suturing for cataract, glaucoma, repair of corneal or scleral tears in keratoplasty operation. So it has the same uses above, but it is suture typing forceps. It has a very fine plain tips. We have no teeth. And the next one is having a unique name is Ruga's intracapsular forceps, also known as capsule holding forceps. It has a cup on the inner side of the tip of each limb. You can see or not, we do have a cup here. I guess in this picture it is not that prominent, but you can search it too in a Google. The tips is having depression, right? So that's why it is said that it is having a cup and the inner side of the tip of each limb. And what's the use? It is used to hold the lens capsule to remove the lens in an intracapsular cataract extraction. Let's move toward the next one. And here it is. It is known as appellation forceps. It has a blunt and flat ends. You can see very clearly here. And it appellates the cilia in trichiasis and styl. What about the next one? It is an artery, also known as hemostatic forceps, artery forceps, or hemostatic forceps. It is a multiple straight grooves near the tip and a locking mechanism near the range end. These can be straight or with curved end, right? So you can see that head or the multiple straight grooves near the tip, and here is a locking mechanism. What the use? It is used to catch bleeding vessels during the operation of the lids and lacrimal sac and to hold the skin and muscles stay suture, right? So this was all about the forceps, and at the start we talked about the speculums, right? And the next video we will talk about the later ones. Thank you so much for watching. Subscribe for more.